Okay, so it's 4 o'clock right now. I think we'll get started just in the interest of time. So I want to warmly welcome you to our Postnatal Care in a Pandemic webinar series. This is our very first session, and we're focusing on virtual breastfeeding education and support. And so the objectives that we advertised in the weekly news and on our website and through social media was really to learn about the priority concerns related to breastfeeding that we've recently heard through the postnatal care rapid response data collection. So we'll just give you some preliminary results related to that. But the focus for today is to really develop awareness about infant feeding resources in the region, and to spend time talking about features of innovative breastfeeding initiatives in the region, and then to talk about tips and tricks for providing virtual breastfeeding education and support. And so just a few housekeeping details before I introduce the panel. This session is being recorded, so we are going to upload it to the CMNRP LINS YouTube channel. So yes, we do have a YouTube channel. I'm asking that everyone mute their microphone just so we have a very clear recording for to be saved and archived. There's a lot of people that aren't going to be able to join today, but we believe that they'll be able to watch the recorded session later. So please make sure that you stay muted for the duration of the session. And we do invite you to use the chat box to ask questions throughout the session. So my colleague, Carrie Ann Berga, she's going to be monitoring the chat box and bringing all the questions together and moderating a question and answer period at the end, just because we do have quite an impressive lineup of panelists for today. If you want to get active on social media, you can use some hashtags, breastfeeding, hashtag infant feeding, and the Twitter handle for CMNRP, CMNRP LINS, CMNRP_LINS. And so I think most of you are familiar with CMNRP, but really we're a regional integrated program. We work together with anybody in the world of perinatal, maternal, newborn care to achieve the very best outcomes for families in Eastern and Southeastern Ontario. And so we do this by working in partnership and collaboration with our partners and again, a range of sectors and professionals to really make sure we're offering a high quality perinatal system that can really respond to families' needs to make sure they're receiving evidence-based care and high quality care. And so, you know, what we're talking about today actually lends itself nicely and is a good example of how CMNRP as a network and an integrated regional program really brought people together to understand, in the context of the COVID pandemic, what was the need that was not being met related to postnatal care. So we heard a lot of concerns about families not being able to access the care and support after birth. And so we were asked to form a task force to look at this issue. So the main activities related to the task force was doing a healthcare provider survey to really look at evidence-based practices. So that's the Provincial Council for Maternal Child Health postnatal care standards. There's 10 of those standards. And then we looked at the Breastfeeding Committee of Canada, the outcome indicators as well, and we included an additional 5. So we looked to see what was happening before the pandemic and during the pandemic. We also were collecting examples of innovations. We knew that really amazing things were happening across the region and we wanted to share that. And so today is really a celebration and an acknowledgement of some really amazing work that's been happening today about breastfeeding, but we will be sharing other innovations related to the other standards. We have worked on a parent survey, so we're in the final stages of finalizing that document, and we'll be releasing that later into the fall. So just a quick shout out to our amazing task force members who worked actually all through late spring, all throughout the summer to do this work. So Dr. Daisy Moores was co-leading this task force with me. And a number of presenters today are actually task force members as well. So we just really appreciate all of the organizations who supported the time for these individuals to participate in the task force. And we actually do have some members who were doing this on their own time. So we really appreciate and just valued everyone's commitment to this. So very quickly, to give you a sense of what we heard from the region related to the healthcare provider survey, we received 42 data collection forms, and each form represents an agency. And we did ask people to work together with their colleagues to complete the data collection form, so it was as comprehensive as possible. So you see that we heard from 16 community agencies. So those are family health teams and community health centers, organizations like Lactation League, and community groups like that. We had 10 hospital respondents, 8 primary care, 5 public health, and 3 midwifery practice groups or associations. And so I don't think it's a surprise to anybody who's on this call today that breastfeeding came up as the top priority concern, followed very closely by maternal mental health. And then the third priority concern was newborn follow-up. And so those themes are actually going to be coming through today's presentation as well. But the concerns related to breastfeeding really had to do with being able to access breastfeeding education and support, and being able to access it in a timely manner, just to provide the necessary support. So that was largely what the concern was related. And so if you take the data, just the words that people used, I like to use Wordles, just it's graphic visual representation, and you can see that it came down to support. That word access is quite large, so the more frequently the word was cited, the bigger the word is. Has to do with care and health and all these words. So I don't want to spend too much more time. We will be sharing more details related to what we found through the task force, but I have this phenomenal panel of presenters who have been working really hard to prepare for today. So without further ado, I want to introduce Erin Shaheen, who's a childbirth educator and doula with the Ottawa Childbirth Education Association, and she also is a task force member.
Thank you. Thank you for having me. So I'm here to chat a little bit about what we're doing in terms of prenatal care and parenting support through education before families give birth. So if Christina wants to switch to the next slide, thank you. So I teach with Ottawa CEA, and I've been there for 20 years. We're a registered not-for-profit, and there are 5 instructors altogether who teach prenatal, parenting, grandparents, and a variety of other classes. All of our classes talk about breastfeeding, chest feeding, and infant feeding alternatives throughout our programming. We teach approximately 1,500 families in a year. We teach predominantly on evenings, weekends, and in private tutoring. And of course, with the introduction of the pandemic and the shift to online learning, we had a quick turnaround time to turn all our classes into an online format. So we did decide to go with a synchronous format in real time, just as if we were offering real classes. We use a Zoom format to teach, incorporating all the same breastfeeding information along the way. So of course, our immediate concerns for families was to have continued access to the classes that were already in session. And we wanted to be able to continue to offer classes and education for families who are registered from April onwards. The predominant focus of our classes initially was the big learning curve in terms of tech online, and some resistance, of course, to shifting to an online format. If we switch to our next slide along the way, we did have an opportunity to move technology and use it to our fullest advantage. So everyone is familiar what this looks like these days, and this is what all of our classes look like. So we are able to incorporate technology for infant feeding into so many new ways than we have in the past. So we are able to use close-up for visuals in terms of what a great latch looks like. We're able to make quick transitions to videos. We use cell phones for allowing families to do some anonymous questions throughout class so that they don't have to ask them orally through a group chat or format in any kind of way. Being online has offered us the opportunity to offer classes across all time zones in Canada. And so we have noticed an increased number of registrations from BC, Alberta. We've had people attend classes from Eastern Quebec, Montreal, and Quebec City. And one interesting piece in terms of offering breastfeeding support along the way is that we have had no cancellations for classes as a result of those regular illnesses that people might be getting, like colds and viruses and flu. So harnessing online learning has been an interesting challenge, but it's offered some great rewards in terms of offering some information. So with the next slide, our focus in terms of offering breastfeeding is also to incorporate all the other activities that help support infant feeding along the way. So we do offer a fair bit of information on the advantage and benefit of skin to skin. We offer a fair bit of information around baby carriers and contact. This is very important at the moment because of the lack of extended family support that families are having. We share some information around safe bed sharing and all of the other factors that help support initiating breastfeeding along the way. So what we've learned for the next slide, of course, is that now that the tech learning curve is over, evening sessions are much more enticing to families. So we're able to increase that sense of community in an evening format with shorter online learning scenarios. It allows us to also offer breastfeeding and infant feeding information incrementally over the 6 sessions that we offer. Our goal is also to continue to offer family support into post-birth services that are now increasing across the Ottawa area. In our next slide, we're able to offer some additional fun props. We're also able to acknowledge some of the personal information and sense of community that we have by stepping right into people's homes in terms of being online. So in our next slide, definitely we see online learning has some additional disadvantages in terms of lack of body communication. We're learning lots in terms of being as effective as we possibly can online. But what we know in conclusion is that we're here for families. We continue to be here for families, teaching infant feeding along the way, linking people to the amazing supports that are coming through, and you'll get a chance to hear all of the other great initiatives along the way. So that's what we have to offer. We'll always be here for families.
Thank you so much, Erin. And it was just so amazing at how quickly you were able to make that transition from in-person to virtual. So thank you so much for the many years providing prenatal education. And it's so important, you know, we wanted to start with this because we know with the postnatal period, it's so important for families to be ready when they're pregnant, to think about that time after birth and to figure out where their resources are and to have appropriate information. So the work that you're doing is key. So keeping on the same theme of prenatal education and using technology, we're going to go next to Jillian, who's a health promoter at Carlington Community Health Center, who's just an amazing innovator and so inspiring. So let's hear about her latest initiative.
Hi everyone, I'm just going to make sure that I've actually set my timer, not for 4 hours and 30 seconds, but for 4 minutes and 30 seconds, so we'll get going. I am very happy to be joining you today, and I'm going to tell you a little bit about a project that we put together very, very quickly when COVID hit, actually in April of last year. One of the big disasters that happened, of course, is that all in-person programming ended very, very abruptly. And that left a lot of families who were already committed to prenatal breastfeeding support sessions or prenatal sessions hanging. And so what we did was rally and communicate with all of those initial parents to bring them into a platform where we could communicate with them very, very rapidly. And we decided that the easiest way to do that was in a Facebook group platform. The goal was really a rapid dissemination of information during what was literally hourly changes in service availability from Ottawa Public Health, from the community health centers, from the hospitals, etc. This was an opportunity for us to facilitate access to information for these families. And we did so in a number of ways. The very first thing we did was upload files to the file section of the group that had access to all of the lactation consultants who could still do either on phone or Zoom meetings with families, any of the LCs in the community who were also still seeing people in person with full PPE at the various different health centers. access to information from Best Start, access to various different resources locally to help parents who are pregnant or parenting small infants. So the initial goal was really to target the under 3-month market. Silly us thinking that it was only going to, we're only going to need to do this for 3 or 4 months. Now we've expanded that to under 6 months. And after 6 months, there are quite a lot of other resources in the community. So we tend to send parents out to those after that initial first 6 months. We also provide online Zoom parent support groups, and currently there are 2 of them being offered every week. One of them is for parents who are pregnant or parenting under 1 month, and I'm about to expand that to parenting under 2 months. The second one was originally parenting between 1 and 3 months, and I'm about to expand that for the 2 to 6 month range. And if you could go to the next slide, please. This is just some of our mummies on this picture here, but here's a logic model that we put together. I'm in the process of doing a full evaluation of the entire platform from April the 1st of 2020 up to October the 31st of 2020. And basically this kind of gives you an overview of exactly what our goals were right at the very beginning. We're very much to be a communication platform, and it morphed more into being really a community. And that is what the parents have fed back to us, is that they are really loving the fact that they get to see other parents with their other babies, and they get to share each other's stories as well as ask questions and have a lot of the behaviors that they're witnessing normalized. So it has been really successful, and I can see all kinds of ways to apply this going forward, and I look forward to seeing what the future brings us.
Thank you so much, Jillian. It's so impressive again to see how quickly we're able to flip that to a virtual format and really facilitate that connection. So related to mental health, like we were hearing about families really having a hard time because their usual social supports and ways of connecting, engaging with other people, including their family and friends, but also other pregnant people, really was impacted. So your strategy here with the virtual parent support program really has done a tremendous service to the community in terms of that connection and support. So kudos, and we look forward to seeing that evaluation. This is a scalable type of initiative, so really exciting. So let's move on to our next presenter, Cindy Kay, who is a lactation consultant and the Healthy Start Parent Support RN at Pinecrest Queensway Community Health Center. So Cindy's going to talk about before COVID and now.
Thanks, Christina, and thanks for including me in this panel today. Next slide, please. Okay, so just to give everyone an idea, before COVID hit, as the nurse and lactation consultant at PQ, my portfolio was varied, and I got the opportunity to do drop-ins with mums and afternoon in clinic. I did Buns in the Oven, which is now being called the Canadian Perinatal Nutrition Program, twice monthly, and playgroups with babies, and then 3 workshops per month, 1 parenting workshop and 2 breastfeeding workshops. Those were all in-person on-site services. So when COVID hit, as Jillian and Aaron have both said, we had to move quite quickly to telephone and virtual support to try and bridge the gap between, we didn't know when we were going to be back in person. We thought it would be pretty quickly. It wasn't. So we right away moved to telephone and virtual support. Within about 2 to 3 weeks, we moved our workshops and our Buns in the Oven program to Zoom. Started up some parent chats, and like I said, I moved my prenatal breastfeeding workshops and my parenting workshop to Zoom. The in-person breastfeeding support returned, I believe it was about April 15th or so, and the way we handled trying to make sure that people in Ottawa had somewhere to go while we wait to see, again, hourly how this support would change, is the CHCs got together and coordinated the days of the week and tried to make sure that there'd be every day of the week covered by at least 1 center. And my colleague following me is going to discuss that a little further. So how are things going now? I'm providing breastfeeding support to 15 to 20 families per week between telephone, virtual, and in person. They can contact me through email or voicemail. They leave me a voicemail or email. I call them back. We have a conversation. I triage them to see whether or not an in-person appointment would be warranted. And so I have 4 to 6 places a week I can use. Pinecrest Queensway is open Monday, Wednesday, and Friday. This was in an effort to reduce the traffic within the center. So I have access to my space on the full days on Friday. So I make a schedule and have about 4 to 6 spots. My workshops on Zoom are prenatal breastfeeding and baby's first year, and I'm seeing a pretty good turnout. Things are starting to pick up now, actually. And continue to work in collaboration with the other community health centers, Ottawa Public Health, and the client's healthcare providers, whether that's a midwife, nurse practitioner, pediatrician, or family doctor. So some positive changes from this big shift. Clients have increased access to my services. So previous, they'd be able to come in and see me 2 days a week. Now they can leave me voicemails or emails 4 days a week. Turnarounds usually within the 24 hours, sometimes 48 over the weekend. They get more individualized care plans. We can plan follow-up. I can promote services to them because I have them right there on the phone or in person. And then partnerships between the breastfeeding supporters in the community have strengthened, which I really love. The trends that I'm seeing, so an increased number of blocked ducts, mastitis, lower milk supplies due to incomplete and ineffective removal of milk from the breast, so poor latching that's going unserviced. Mothers on domperidone, often without follow-up LC care. Babies with long-term weight struggles going into 2, 3, 4 months old and still falling off their weight curves. And almost every client has a complaint of low mood, depression, anxiety, loneliness, and isolation. So our continued challenges, the biggest challenge for myself is the number of patients. There are some weeks where we're unable to meet the need, being just the one person at my center. It can be difficult to collaborate care with other places. They may or may not be able to go in for weight checks at their physician's offices, and then follow up. It's really driven by the mother. So we set times, a few days or a week in advance. Sometimes it works out, sometimes it doesn't. So it's really up to the client to advocate for themselves and get in touch with us if we are not able to make repeated contacts. Thanks, Christina.
Thank you so much, Cindy. You do a lot in your role. And so I know I gave everyone 5 minutes for their presentation, which is very challenging because every single one of them could have taken the full hour. So thank you so much, everybody. And I think, Cindy, like you were just new into your position 3 months in, and then the pandemic hit. And I remember you telling me just about the amazing support that you had from your manager, your supervisor team, and just really being able to troubleshoot and figure out how to make that a safe environment for you as well as for the clients that were coming to the center. So for me, when I heard that, it just reinforces the importance of anyone on the call who's, in a leadership administrative position, that it's so essential, like always, and then for sure in the pandemic, to keep things moving as quickly as possible as people try to respond to the care needs. So thank you so much for overviewing the services available at PQ. Next, we're going to talk to Sue, who's going to focus on interagency collaboration and how did the Ottawa area really mobilize to make sure that there was good coverage and support for families. So Sue, you're on mute still. And so Sue's a lactation consultant at Southeast Ottawa Community Health Center, and she's also in independent practice.
So like Cindy, we had to pivot very, very quickly. I had 2 breastfeeding clinics per week, and my manager has been extremely supportive of supporting moms and breastfeeding, and that was a very important priority for our center. So we actually only stopped 1 day with in-person, but had to shift very quickly to an appointment-based system. And with talking to all the other community health centers, trying to sort out how moms could access help 5 days a week. So the 2 parts to this were to get mums, one, to get the information out. So we also worked in collaboration with Ottawa Public Health, who has information on Ottawa Breastfeeds, to make sure that the information was available. So those mums can get phone, virtual, or in person the 5 days a week, as you can see here. So I do Mondays and Thursdays. All the community health centers are by appointment. So it's a variety of either phone, leave a message, we will call you back. It doesn't have to be on the day of. It can be left, say, on the weekend, and we will get back to you that the day we are available. So if the mums can do this, so it's either by email or phone, and then we can triage. So the triage system is initially, of course, by phone, but the other piece with this, with virtual, which didn't initially begin at the very first few weeks, it was a scramble just to figure out how to even just to see them. But virtual came and has become a good triage tool, because you can switch to it immediately if the parents are telling you something specific, and you can say, okay, let's see what's going on, and you can physically do that. With the different EMRs, I have used ours, which is PS Suites, and then the other one is also the Ontario Telemedicine Network. But that has given me a really great triage tool moving forward, because I can assess those mums to say, yes, I really do need to see you in person, or even give them enough information and help to get them to their appointment time. So whether it's through me, or if it's really urgent, to see if I can contact with one of the other community health centers to see if I can get them in earlier. So that's been a huge bonus for all of us, is working in collaboration together, and we've done a lot of support. So that's been very, very helpful. Public Health does also have an info line 7 days a week, and they've just moved recently to be able to see people only on an as-needed basis 2 days of the week. So that's a Tuesday and a Thursday currently. We'll move to the next slide. So the other thing that came out shortly after the pandemic hit was the realization that many, many, many parents would go to the many drop-ins that were available before just to get their baby's weight done. And with all the changes, with all the different physicians and support systems out there, that was no longer available. So again, we went and came up with this point of, again, Monday to Friday, have a location where parents can come and just get their babies weighed. So again, it has to be by appointment. This way everybody is safe, but then they can take that information back to whichever healthcare provider they are working with. Again, they can phone either ahead. It's much easier to get an appointment for a weight check because they're very, very short. They're not meant to be a medical appointment or to deal with breastfeeding. It is mainly just for a weight. So these are the 5. Again, it's all the different community health centers. And most of us will take babies from anywhere except for Somerset West. They are using and just going by their catchment only. So the last piece, again, is more support across the system. And again, it's getting the information out there. So there's also the independent practice lactation consultants that are available in the region. Some are doing virtual, some are doing in person, some are doing office, some are doing a whole combination of different things. So it's, again, getting this information out there so that the parents and the providers know that this is also still an option. It has changed from the very first part of the pandemic to nobody doing really in person, or very few, to moving into now sort of stage 3, where there's more availability for in-person visits. But again, it's just contacting them and finding out. So this information can also all be found on Ottawa Breastfeeds, but the biggest piece that we found too has been getting the information out there so that providers can find it and pass it along to the parents can find it, and all the other community resources out there know what's available.
Thank you so much, Sue, for summarizing all that information in those slides. We definitely heard that as well, that people didn't know what was available. That was just months and months and months, and we still hear that now. I don't know where I can refer clients. So we hope that those slides are useful in terms of having a sense of across the city what's available, and then the private practice LCs as well, if people have the resources for that. So next we're going to move on to Joss Anderson, who's a family physician and a lactation consultant who works at the Monarch Center and the Ottawa Hospital Civic Campus. So when someone gets the support that they need and an assessment, but they need more detailed intervention and support, then what's that going to look like? So Joss, on to you.
Thank you. So I'm a family physician, but I have a focused practice in breastfeeding medicine. So before, and I'm going to kind of guide you through the similar pictures my colleagues have today and echo a lot of similar things. But before I would work at Monarch, I would see our routine discharges and I'd kind of mix my consults in throughout my days there. So when the pandemic hit, Monarch was in an interesting place. So for those that don't know, Monarch is a transition clinic model, so hospital to home, home being their primary care provider. So we tend to have dyads discharged directly from the hospital, and they'll do their first few visits with us where they see one of our family physicians and our nurses who are all lactation consultants as well to get that support. So when the pandemic hit, we actually saw our volume increase substantially. Because of lack of access to their primary care providers. And then we also had to restrict our core services down to just our dyads coming directly from the hospital as well to keep them safe and healthy as well. So my role really evolved into more of a telemedicine role. So initially there was a lot of fear. A lot of patients were refusing to come into clinic with very worrisome clinical pictures, and they were still refusing. So, it was kind of being able to do a check-in and try to figure out how to weigh these babies or where do I send them for jaundice. What then happened was we kind of got that sorted out, and then I shifted all of my consults virtually. And the only way that I can really sustain that very well is with all these wonderful faces around our table. Our Zoom webinar here is with that collaboration with the community, as well as with my other physician or healthcare providers, nurse practitioners, and nurses in the community as well. So some of the benefits that I've seen is I think we're reaching patients sooner. So a lot of my consults would sometimes be later, a month or so after. So I'm actually starting to see in some ways patients are coming to me sooner. So that's one benefit. The other thing is it does actually prevent a little bit of disruption to their routine. So we know that when these patients come in for their appointment, they often will miss a feed or they're uncomfortable feeding in public. So they'll resort to formula use, which can be an indication of low milk supply or lead to rather low milk supply as well. And then the improved collaboration between community partners. So really linking up with, who can I rely on to get a weight check, or where can I see them, or just discussing, because I've had to rely on my primary care providers to do exams and to do weights as well. Some of the challenges that you're going to see, my reoccurring theme here is weight is one of the main challenges. So weight, assessing for tongue ties, so any oral tissue restrictions, breast lesions as well. And then really I'm getting, complicated scenarios because there is the delay. Some I am seeing sooner. There is a delay in referrals or just delay in care or due to access issues as well. Initially, a lot of that was because, our primary care providers didn't have the PPE, right, to accommodate or even see those patients, and their offices were closed. And now there's still a lot of access issues because of infection protocols and staffing shortages as well. So solution is this collaboration that we're talking about today. So just a few tips that I wanted to mention. So one is weight I wanted to talk about. So weight, so first of all, if you're listening today and your patients are at the Ottawa Hospital, I encourage you to have them discharged directly if they can to Monarch, because they will get that weight and support right off the bat. And once they're kind of teed up, then we send them back. We also have set up kind of grad networks too as well, so to find some primary care providers if needed for those patients without. Some of the unique things, so I've been doing the weight checks through the community health centers. I've used, or we have a list of where rental scales are for baby scales. And also I've used the good old kitchen scale, which I never mentioned before, or used before. So I will have some families who just refuse to go out or are very fearful, and we will use a kitchen scale and a big empty light bowl and just zero it and weigh the baby in there. So that's one. The other thing is just that I see a lot of in round to weight still is that they get one weight at discharge and then they don't get booked back until the 2 month, because a lot of primary care providers are trying to limit that contact, exposure if needed. So it's just to make sure that I would encourage my partners to make sure that we're doing frequent weights. So we tend to see babies every 2 to 3 days until I have kind of 2 good weight gains. And then I kind of expand it up to a week or 2 weeks from there. And so just keep a close eye on that. A few other things that I've noticed is, and this is a recurring theme we've seen before, but the lack of recognition with swallowing. So if you're hearing feeds are taking more than an hour, it's a red flag that you want to get these partners here involved with some help. Pain as well. So, it's abnormal if there's damage or it's ongoing over that first few days. Cindy already talked to a few of these. I'm also seeing a lot of use of domperidone, which rarely is warranted. So make sure that these families are having frequent milk removal. And if you're giving or suggesting they need to supplement, make sure they're pumping to build up and protect their milk supply. And then the last thing, the most important thing, is what we've been talking here about today, is the resources. So making sure you know where they are and where to access them, and where your patients know where they are and how to access them. And really encourage those prenatal classes as well, because that's going to really help prepare them so they don't fall into what I call the big black hole of the unknown after when they prepared for their labor and everything. All right, thank you.
That's awesome. Thank you so much, Joss. You covered a lot in that session, and what you're doing is really phenomenal. Like just in terms of that hesitancy to go out and seek service, and now you're coming to the clients. So that's really, really amazing that there's so much that we can do virtually. And just that connection. I'm looking, my colleague Lauren Rivard's on the call today, and a few years back we were doing a lot of work related to postnatal discharge, and again, like it was that whole emphasis on preparing for the time after birth. But the ironic thing is that when people are pregnant and they've not had other children, they don't realize how much they have to actually learn and put in place to be ready for that time after birth. So we continue to struggle with that to help families realize that there's quite a bit that they need to do to be ready, what's normal, what would they expect in terms of sensations related to breastfeeding, and where can they go to get help if they have questions or if things are coming up. So very interesting. Thank you. We're going to move on next to Sonia Boersma, who is a familiar face to many of you, who's a lactation consultant for Lactation Care, and she's going to continue the conversation about how do we support doing breastfeeding assessments virtually, and how can we connect families with on a virtual platform. So Sonia?
Thank you. Yeah, we recognized very early, of course, that we couldn't get into people's homes. And although there was maybe one in this area that was going into people's homes during phase 1, most people weren't going into people's homes at all. So that meant trying to figure out another way to do this. So virtual consults happened quite frequently. You can show us the next slide, please. So, and a lot of the community supports were reduced. So there were fewer in-person supports, and even just fewer supports, period. Come phase 2, stage 2, a lot of people were allowed back into people's homes, but the non-RN IBCLC still weren't. So there was a bit of a shortage, and the virtual consults kind of saved the day all around. Next slide, please. So we learned a lot about how to do a virtual consult. First of all, prepping the client. We asked for a second person to be present, and as you can imagine, early on that wasn't so much of an issue. It can be, though, still. And because that person could direct the camera, when we're doing consults, we're often like needing that bird's eye view that the mother gets. And so we needed a flexible camera, often a phone, where the cameraman, who was usually the partner, would show different angles. So we asked for that. Sometimes people would set up a camera and a laptop, like a cell phone and a laptop, and they'd have that flexibility. We had clients, we had to make sure that they were okay on the technical end, and also discuss lighting. As we know now, it's much more known now, having a window in the back is not good for lighting, and we particularly needed good lighting to see the baby's chin and neck, get rid of the clothes. So we sometimes suggested even having a flashlight handy so that we could see how the muscles were being used and how weight transfer was occurring. Next slide, please. We had to prep ourselves by choosing an online platform, ensure we were in a secure environment so that people within our own household weren't listening in. Consider our background so that it wasn't anything embarrassing or inappropriate. Obtain consent from the client. Use a password protected link. We obviously need to ensure records are secure. That's not new with COVID. Having tools around like model breasts, here's my Hudson's Bay breast, dolls and whatnot, and even being able to move around because we had to, show more of ourselves, less of ourselves, maybe a profile, so that people could see what we were trying to demonstrate. And we had to really be knowledgeable about the resources that were online and also in the area, so that if we were doing consults in a different area than our own, we could help direct them to what was local. Next slide, please. So we learned there's a lot that you can do. I personally was very surprised by how effective they could be. So it's quite doable to assess milk transfer, lip tie, a low supply, latch, positioning of mom and baby. Physical assessment, it is eyes on. You can't manipulate anything, but you can see how this baby's, what the baby looks like. You can observe normal behaviors and teach about expectations. What was difficult to do, impossible, would be a suck assessment, weight, as Jocelyn mentioned. In that regard, everybody was concerned about weight. So I did a pump and scale rental document that is on my website and is about to get updated. With tongue ties, we could direct the moms to some extent to show us what we wanted, but that was actually really challenging. And the odd mom was challenged to follow instructions or verbal cues. Weight checks wasn't possible, but you could really dig into the peas and poops to find out what was happening. And sometimes it was difficult to guide the videographer. Sometimes they were just jumping in to help, and then you might be looking at the ceiling for a minute. But overall, they did a really good job. Next slide, please. The positive outcomes are that we can see people from any geographical region, and I think that's quite a great learn, because now we can open up access to people with internet. So urban, rural, northern. So that's really quite exciting. For the provider, there was no driving. It's very time efficient. And we definitely know that virtual consults can be done. And I'm just going to mention another initiative that we started with lactation care. In fact, it was Sue and I who started this. Virtual group sessions, IBCLC. So they're almost a bit like a postpartum class with focus on breastfeeding. So there are 4 sessions over 4 weeks. There's educational topics, there's discussion, questions, and mother-to-mother support. This is really exciting because parents are really needing some more mother-to-mother support, so we're trying to meet a need there. So we discuss many topics related to breastfeeding, but also baby and mom well-being. And we might talk about breastfeeding in public. People aren't doing that as much anymore, but maybe they're breastfeeding in front of their father-in-law or whatever. So it's still a relevant topic. And then the last slide is the other resources that are available, such as Lactation. The breastfeeding drop-in that Sue and I run on Wednesday afternoons is still available. It's the only drop-in that's still left, although we do like appointments. Motherwit Doula offers postpartum care. Postpartum support drop-in for moms is available all virtually, related to anxiety and depression. Telehealth Ontario, they're pretty busy, but it is nice to have someone to contact in the middle of the night. And Ottawa Breastfeeds, it was designed for the Ottawa area, but again, so much is virtual that these supports apply to many people in many places. Thank you.
Thank you so much, Sonia. And again, a really great example of innovation, looking at the gap and trying to identify a strategy to fill the need. So that's a really neat initiative, IBCLC, and we look forward to seeing how that evolves. For Lalesh League, you mentioned Hillary Johnson, who's one of the Breastfeeding Promotion Committee members. She wasn't able to join the session today, but she did send a few slides that I'm just going to quickly share with you in terms of the variety of supports that are available. And again, with the data collection process, we did hear from lovely leaders from different communities, and some small communities saying, listen, like, we're still here and we're offering everything virtually. And again, they flipped that very, very quickly. So don't disregard existing resources that have been around in your communities for a long time. And so the person that actually had contacted me had been providing breastfeeding support for over 30 years. And I just have like chills thinking about, you know, the support she's provided to moms, and even more so during the pandemic. So here's a variety of the social media avenues that they have in our community. And then she's also shared some Francophone resources as well. So we'll share these slides with you after today's session. So I'm going to turn it over to Carrie-Ann Berga, my colleague, who's the lactation consultant and a full-time perinatal consultant.
Hi, everyone. Thank you so much. Really great and inspiring innovations and examples of collaboration and integrated care have been shared. So thank you, everyone. So as Christina mentioned, my name is Carrie-Ann Berga. I'm a perinatal consultant here at CMNRP. I'm also the lead for the CMNRP Breastfeeding Promotion Committee, along with our chair, Sarah Siebert, who unfortunately was not able to join us today due to work commitments, of course. So the purpose of our group is really to protect and promote and support breastfeeding. Part of our recent work focuses on reducing unnecessary supplementation. So pre-COVID, our committee had collaboratively conducted an assessment of barriers and facilitators of providing skin-to-skin care. So that was sort of the first topic that we were focusing on. And we did that needs assessment, or assessment of barriers and facilitators, with various partners, including family advisors. So from this, the Breastfeeding Promotion Committee Supplementation Work Group has created various task forces that we're really trying to implement targeted strategies based on what the barriers and facilitators are. So of course, due to COVID, the theme here is that, you know, some of this work has been put on hold. However, our work continues, and we continue to meet every 2 months. So I just wanted to offer the opportunity to connect if you would like more information on our initiatives, or would like to become involved, or if you'd like to connect with any of our members. Many of the people here, participants as well as panelists, are part of the BPC, which is excellent, or Breastfeeding Promotion Committee. So please do feel free to contact me. I would be very happy to hear from you, and also passionate about this topic as well. So now I think we're going to move on to the Q&A session, which I'm happy to facilitate. So if you have any questions, go ahead and you can pop them into the chat there, and just at the bottom of your screen. We do have one question so far, and it could be probably for Sue or Sonia. Are the resources that you shared posted somewhere online for the public?
So I can take that one. So the weight checks and the availability of the Community Health Center is also available on Ottawa Public Health. And as we know, Ottawa Public Health has been drastically shifted because they have been pulled directly into the COVID response. So they've been really trying very hard to get the information out there. We worked with them to try and make sure that they had this. So it is on their website. It is a little challenging to find. I will be blunt, they know that. So if you look under, I do believe it's the Parenting in Ottawa drop-in page on Parenting in Ottawa, it will pop up. So that is where you'll find information about community health centers, and some of the information health centers has the as well. All the private practice, and also all those community health center drop-ins are also found on ottawabreastfeeds.ca. So there's a calendar feature there, but also a listing of all that information. The weight check information by itself is not found as a sole piece, but it is all through the community health centers.
And I might just drop in that the pump and scale rentals, that document is available on my website, Lactation Care, under the Resources tab, and I need to make a couple updates because I just did all the updating on personally, but I will be updating that, and most of it's up to date anyway right now.
Excellent, thank you. And I think Jillian is going to add something to that as well. Thank you.
Yes, I just wanted to let everyone know that I will have all of these resources in one document entitled Breastfeeding Resources for Ottawa Parents in the files section of the Facebook group. So that is one thing, as all of my colleagues in the community are working on these really important documents. As soon as they're done, and Sonia, shoot it to me and I'll make sure that it gets updated. And any changes that take place, that's where it's going to go. So we've got 300 people in that group, and that's one of the whole reasons for it, is to have one place where everybody can get everything when it comes to weights and finding an LC, holding hands with an LC from the time they're pregnant forward.
Excellent, thank you. Which group, someone wanted to know which group that was?
That is the Facebook group, and it should be in the notes for this session, but if you can look it up under Ottawa Prenatal Breastfeeding Support. We'll be changing the name shortly, but that's what best reflected what we were doing in the beginning. So it's Ottawa Prenatal Breastfeeding Support. It is a private group, so you can only join if you answer the questions, but if you're a healthcare provider, you can let me know, and I can invite you to the group as well.
Excellent, thank you so much. So I've opened up the chat. If there's additional questions that you have, or if you'd like to unmute yourself.
If you want to.
Okay, Teresa, there's a question from Teresa. Do you want to unmute?
Hi there. Hi, everyone. So nice to hear about all these initiatives. Sorry, I'm just going to put myself on there. I was wondering if any funding issues had arisen to maintain some of the services or to fund some of the new initiatives. I did hear that a couple of presenters mentioned their supportive managers, so I thought that's great, but I wondered if there's been a difficulty with funding, especially as I know because of COVID, there are other priorities where funding is going. So I don't know if anyone wanted to comment on that.
Hi, Teresa. I know that, you know, speaking of supportive managers, certainly Carlington has been incredibly supportive of this initiative, and I know they are looking at some funding to do some expansion. I know that there has been some recent documentation, some recent studies that have come out showing that maternal mental health is really being strained during COVID, and there are reports of it, you know, being 3 to 4 times the number of reported instances just in the last 6 to 8 months. So I'm pretty sure that there is some funding available there, and I'm certainly hoping to be able to access it to expand, and to be able to expand outside of catchments. We're very lucky that I'm not bound by catchment, so I can take anybody in the Champlain-Lynn. But certainly that's on the radar for us.
Great question, thank you. Any other questions?
Teresa, maybe you'd like to mention a tie-in to Jillian's statement about the perinatal mental health resources that you are aware of.
Mm-hmm. I know that we had started an initiative with Royal around women's mental health, specifically perinatal women's mental health, and along with Nancy Kennedy from the Royal. That funding is coming, it's ending within a few months, I think before the end of the year, or by the end of the year. But initially we had started as a partnership with the Birth Center, the RAP program, where there were groups, in-person groups. So they have moved to virtual, But there is a problem with funding there. That's why I wondered if there was a need for some kind of concerted effort to address any funding issues if they had arisen. But right now, the Ottawa Birth and Wellness Center has also initiated a number of Facebook Live events around perinatal mental health. And the RAP groups are continuing. But like I said, I think it's towards the end of the year. Well, unless they get additional funding, I'm not sure if the program's going to be able to continue.
And so because that was the second priority concern, mental health, we are going to have another webinar series specific on that. So Teresa will be looking to you and to Nancy, and then other initiatives we want to profile. So one thing related to breastfeeding, not on the client side, but the provider side, is about breastfeeding education. And I was thinking, Sue or Sonia, when you pulled up the knitted breast and all the props, I was thinking of Carrie, who just last week did virtual breastfeeding education, our CMNRP breastfeeding workshop. So Carrie, did you want to talk about that for a second and how we've changed our professional development to adjust to new realities?
Yeah, we've really pivoted a lot of our educational opportunities. And it's funny, when I first started at CMNRP just over a year ago, we were talking about, blended learning and how we could integrate this. Well, now we have really moved to blended and online learning with many of our workshops. So for the breastfeeding workshops, what's called Best Practices for Healthcare Professionals, we've moved to a blended online model. And so there's an asynchronous session or section where people access modules via Google Classroom. And a lot of them are screencast lectures, YouTube videos, activities that people can work on their own, so they can really see some of the, see breastfeeding in action, see what a good latch looks like, that kind of thing. And then the afternoon session, we meet on Zoom for 3.5 hours. So I could really relate to some of the tips and tricks for, providing education in the online setting. And, the idea of, trying to show things online and then having videos to supplement that so that people can actually see what you're talking about. So yeah, we had our first session on October 8th. The feedback was positive, and so we'll continue to work away at that and continuing that quality improvement cycle with the course. But I think overall it went well. Christina was there with me and was there as support and backup, and engaged group, lots of discussion, and looking forward to continuing this while we can't meet in person, of course. Thank you for that question.
So I think just in the interest of time, everyone has very long days. I just want to have a huge thank you to our panel presenters. You're absolutely inspiring with your innovations, your dedication and commitment, and just the high level of collaboration and networking has just been extraordinary. I've just been impressed since the spring as I see you working so hard. And I keep saying, like, sometimes you just take it for granted, but I don't think every community has that. And so I just want to congratulate you and thank you so much for all the work that you've done and continue to do each and every day. Like, you guys had full clinics today and you're coming right here at 4 o'clock. So thank you for your time to prepare, to staying within the 5 minutes. That was really tough, but I really appreciate that everyone had a chance to share. I'm putting in the chat that you can send further emails to the CMNRP info@cmnrp.ca. Email might be the best way, and then we could send it to the right kind of person. So if you wanted to connect with any of the presenters today, or Carrie, who supports the Breastfeeding Promotion Committee, or whatever way we can link you, we're more than happy to do that. We know that breastfeeding is a priority concern. We're just scratching the surface today, talking about what that could look like virtually as we've adjusted to the COVID pandemic. It was a concern before the pandemic. It's still a concern, and there's still a lot of work that we're doing in that regard. The main message today is that there's actually quite a lot of breastfeeding supports, and so we hope we increase your awareness of what's available in this area, the different types of supports, and really that message, if we can engage families while they're pregnant to learn as much as they can, figure out where their breastfeeding supports are, who are they going to call if they have questions, that's going to be really critical for that time after birth. And so I do want to acknowledge and thank my colleagues as well who've been working behind the scenes. So special thanks to Ariane Cloutier, who does so much in terms of the registration, our webpage, and social media. Catherine Gascon has been busy doing timer and sending little messages to our speakers to stay on track. So thank you, Catherine, for that. Carrie Ann Berga for monitoring the chat box and moderating the Q&A, and the amazing support from our regional director, Darlene Rose, who was also supporting the task force along the way. And I do mention that Carrie as well as Sonia were also task force members, so I forgot to mention that when I introduced you. So thank you so much, everybody. Have a great night, and we'll be in touch with information about more webinars.